All right, we're recording. Hi, my name is Miguel Valdez, and today I'm here collaborating with Rochester Healthy Community Partnership, RHCP, and today I'm here with my friend Luz Molina. Hi, Luz.
Hi, Miguel. How are you?
Good, getting ready here for getting the kids ready for the back to school, getting ready with all the supplies, getting all the letters from the school district, and some of those are that we should, as a parents, stay up to date with the vaccines. Do you remember those days?
I remember that a long time ago, but yes, I remember. Yeah.
So tell our friends what we're going to be talking about today.
Yeah. So today we invited Dr. Price. She's going to be talking about HPV vaccine because she's going to explain what is the importance of this vaccine and why, even though it's not required, it's a vaccine that is very important to have it for our kids. So good morning, Dr. Price.
Good morning. Good morning. Thanks for having me today.
Hi, Dr. Price.
Hey, Miguel.
Hi. What can you tell us a little bit? What is HPV?
So HPV stands for human papillomavirus. So it's a virus that is present that most people, as they go through their childhood into adolescence and adulthood, will be exposed to this virus. And so it really is something that everybody is at risk to get. HPV is tricky because it doesn't cause any symptoms. So when somebody is exposed to the virus, they won't really know. So it's unlike other viruses, for example, the flu virus that will cause, symptoms and make people feel very sick. The good news is that, most people will be exposed to the human papillomavirus and their own immune system clears the virus, but there's a percentage, probably about 10 or 20% of people that don't ever clear it. And so they can be at risk to develop a cancer related to the virus in the years that follow. So generally, if somebody has an infection with the HPV virus as a child and they don't clear that virus, they might get a cancer 20, 30 years later that could have been prevented. So the HPV vaccine is a tool to basically help your immune system clear that virus when you're exposed to it so that you never go on to develop cancer in the future.
So I hear that it's very important to protect for cancer, but why some people still say that doesn't protect against the cancer, many cancers? Why?
So, there are many different cancers out there and they are caused by different things. Some of the common cancers, for example, like cancers of the lung, are strongly related to smoking. And so that's the main cause. The HPV virus causes a number of different cancers, but it doesn't cause all cancers. So HPV will cause cancers that can start in the back of the throat or in the tonsil. That's what we call head and neck cancers. It can cause cancers of the cervix or cancers of the anal area. Those are the three kind of main areas that it will cause. So the HPV vaccine is very effective if it's given before someone's exposed to the HPV virus. It's very effective at completely preventing those cancers from coming up. But HPV vaccine won't prevent breast cancer or lung cancer or other types of cancer. But, it is the only cancers, that we have a vaccine to
Preventable.
prevent, so it's a really amazing, important tool that we have that we should be using to protect our kids.
Okay, so at what age and who needs to be vaccinated?
So the earlier the better is the message. The earliest that you can get the HPV vaccine is at 9 years old. So, we recommend that parents think about giving their HPV vaccines to their kids starting at 9. If you look at the standard immunization schedule for children, it's recommended for all boys and girls at age 11 or 12. And so the earlier the better. Now, that doesn't mean if you have kids that are a little bit older than that they can't get vaccinated as well. So you can actually give this vaccine, all the way up through the age of 45. But again, the really critical thing is that the earlier the better. It has more efficacy. It's more effective at preventing cancer if you give it early on. So we really encourage parents to start thinking about it or giving the vaccine, as early as age 9.
Yes, thank you for mentioning that. That is important to have boys and girls, the vaccines, because one of the misconceptions is that it's only for girls.
Yeah, that's a really good point. I'm glad you brought that up. There's been a lot of confusing messaging over the years related to the vaccine. And part of it is that originally, when it was developed, it was, intended for cervical cancer, which only girls are at risk for. And so the initial approval back in 2006, I believe, was just for girls. But then just a few years later, when it was recognized that HPV was causing a lot of cancers in the mouth and the throat, and that those cancers actually affected boys more than girls, there was an extended sort of recommendation to say, no, boys and girls need to be vaccinated against this. And so even though that has been the case since about 2009, there still persists this, myth that it's really just girls that need to be vaccinated. So absolutely right, boys, girls, everybody.
Luz, is there any other myths, Luz, that you're aware?
Yes, I also was reading that the vaccination is not safe.
I mean, I know there's a lot of concern these days about vaccination, and obviously, parents are looking out for their kids. But we can, be really confident with the HPV vaccine because it's been around for a very long time, and it was developed over many years. So really, there's been, many, many, many decades of experience with the HPV vaccine in development and then using it. And so millions and millions and millions of people have received the HPV vaccine, without any, significant complications or side effects. So I think we can reassure people that may be a little bit scared that this is not a new treatment. It's not experimental. It's one that we really know a lot about and really, really know that it's very safe. I think what people and parents, of course, when you have a child, you don't think about, what that child might have to go through when they're 40 or 50 years old. But, if we look at cancer treatment, whether it's for HPV cancers in the mouth and the throat, or whether it's cervical cancer, those are treatments that are very difficult for people to go through, that can change their life, forever. And many people will die of those cancers. So if we look at, what is the potential risk of not vaccinating, we're talking about, your child potentially dying early, from a cancer that was preventable, or having to go through, very, very difficult treatment that could impact the rest of their life. And so if we weigh, what the, risks of the vaccine are, there's really no comparison between those two.
Yes, thank you. Another myth is the vaccination can lead to infertility.
There's also no data, no evidence that would tell us that. Yeah, no, absolutely not. I think there's lots of different things that can cause infertility, but it certainly is not the vaccine. So, we don't need to worry about that.
Yes. Also, I was reading that the vaccine doesn't protect against enough strains of the HPV.
So there are many strains of HPV, and some of them are what we call high risk strains, and some of them are what we call low risk. So the high risk strains are the ones that put people at risk for cancer. And the currently available vaccine, vaccinates against all of the high-risk strains that cause, the vast majority of all of the cancers. So yes, it's not a vaccine that covers every single strain of HPV, but for example, if we look at cancers in the head and neck area, in the mouth and the throat, 90% of those are caused by HPV 16. And HPV 16 is covered by this vaccine. So it is a vaccine that is really covering, the vast majority of the strains of HPV that will cause cancer in the future.
Yes. Well, another one you already answered is not just for girls, it's for boys and girls, but there is another one that says getting the HPV vaccine will encourage adolescents to be more sexually promiscuous.
I'm really glad you brought this up because, I think one of the things that has really been hard with the HPV vaccination is, the way that HPV is contracted. So as you mentioned, HPV is sexually transmitted. So that, that means that, that's really where most people are getting their exposure. But what I like to tell, patients and just, people that I have conversations about is that, if we think about our children and we say, okay, what do we want for our kids? We want them to grow up, to be healthy, to have their own family, to have their own grandkids someday, right? So, you know, sexual activity is a normal part of growing up and becoming an adult. When we look at HPV, even if you have one sexual partner in your entire life, you have doubled your risk of HPV. And so, yes, it's true. The more sexual partners you have, the higher risk you are. But even if you have just one, you're still at significant risk. So I think that it's important to not think about HPV as something that just applies to people who, are very promiscuous and have a lot of sexual partners. It really just applies to everybody who's living a normal, healthy life. And there actually have been studies that have looked at the question that you're talking about, Luce, which is, if you give the vaccine, does it change behavior? Does it make somebody be more risky with their sexual behavior? And those studies have not shown that. They've looked at big groups of girls that have had the vaccine and that have not had the vaccine, and they don't see any higher risk of teenage pregnancies or sexually transmitted diseases, or more sexual partners. So I think that that's, a concern that's always out there, but that really has not borne out, in the data and in the behavior of adolescents.
Yes, another one that I was reading is that HPV is very uncommon. So why do you have to bother to get the vaccine?
So yeah, it's absolutely not uncommon. 80 to 90% of adults, will be exposed to the virus. And most adults, thankfully, will clear the virus, meaning their immune system is able to get rid of it. But not everybody, and so 10 to 20% of people do not clear the virus. And then that virus lives in their body, for many, many decades and can cause cancer. And the problem is because there's no symptoms for the vaccine, there's not really a test for it. There's really no way to identify, who are the people who didn't clear it, And so the flip side of that is, because we have this tool, it's actually just much more effective to have everybody get the vaccination, since we're all at risk. But it is very common. And because it's a virus that, can be passed to other people, the more people that get vaccinated, you're not just helping yourself, or your children prevent cancer in the future, but you're also kind of decreasing the amount of HPV that's just out there, being passed around. And so you're actually helping everybody, by getting vaccinated. It's similar to getting the flu vaccine, right? You help yourself, but you're also helping to protect those people who, maybe are at risk, or could die from the flu. The more people we vaccinate in our population, it just helps to decrease the burden of that virus in the population overall.
Yes, another myth is that the vaccination is not effective at preventing cervical cancer.
So also we have, really, really good studies that have been done over many years. So there is a study that was published, a number of years ago now in the New England Journal of Medicine, which is our, sort of highest, medical journal. And what they did is they looked at girls who were vaccinated and those who were not. And they looked at girls who were vaccinated kind of earlier on, so kind of, before the age of 17, 18. And they looked at girls who were vaccinated after 17 and 18. And then they looked at girls who were not vaccinated. And what they could see is that the girls and then they followed them over time, over many years, to see who developed cervical cancer. So when they looked at that group that was vaccinated before the age of 17, there was almost no cervical cancer, almost zero diagnosed in that group. If they looked at the girls who got vaccinated a little bit later, there were some cancers that developed, but it was still significantly decreased compared to the girls who weren't vaccinated at all. So you could see this clear stratification of risk. And so, what that means is, one, the vaccine is very effective at preventing cervical cancer. And it speaks to the message from a little bit earlier, which is, it's better to do it earlier on, because ideally you're doing it before there's any sexual activity at all, so that the immune system already recognizes the virus. And so that when that child or teenager or young adult is exposed to HPV, the immune system is ready, it's there, it clears the virus, and that's the end of the story. No cancer as an
Doctor,
adult.
since we know the effectiveness of the vaccine, is this a series of vaccines or is it just a one-time shot?
So it is a series, and another really good reason to vaccinate earlier is that you only need 2 if you're vaccinating your child before the age of 15. So they'll need a series of 2. If you're vaccinating after the age of 15, then it is a series of 3 vaccines, given kind of over the course of a year. So if your kids don't like vaccines, I know my kids don't like vaccines, so it's a definite motivation to get that HPV vaccine in early, so you have one less fight that you have to have with your
What is
child.
the window time between those two if you get the early one?
So if you get the earlier one, so you're going to get the vaccine, and then you have to wait, at least a month before you can get the second one. Yeah. But you want to do it like within, within like 6 months, so you kind of get that prime, and otherwise you kind of have to start the series over. So it's good to get it and get it done.
Yes, somebody asked me, if you are 50, can you have the vaccine?
So you can have it. It won't be covered by insurance at that age. So there's a really strong recommendation for vaccinating everybody through the age of 26. And then there's, the vaccine is sort of approved and covered by most insurances through the age of 45. The magnitude of benefit lessens the older you get, but there's still potentially some benefit for it. And, there's nothing magical about the age of 45. It could be that somebody who's 50, also could benefit from it. But that's not how it's approved so far. So you could request the HPV vaccine at any age, because many of us who grew up, in our childhood weren't vaccinated for HPV as children, so I've gotten my HPV vaccine as an adult, just because I see what can happen, from this virus. But you would have to pay for it, out of pocket, which would be several $100s if you're doing it beyond the age of 45. But most insurances, I'm not aware of any insurances that won't cover the HPV vaccine for children or for, young adults and even adults up through the age of 26. So.
Wow, I just learned so much. I don't know you, Miguel, but I am convinced that you need to give this vaccine to your children.
Yeah, prevention is the key, and especially since Dr. Price mentioned, if we would have vaccines for other cancers, everybody
yeah.
will be taking it. So as a parents, we should consider this and schedule. And if you still have some questions, do research and go to sources where you get information and help your kids.
Yeah, so we are ready to go back to school, and this is the time to take this in our hands for our kids to protect them.
Agree.
So
Absolutely. And I think, just because the HPV vaccine is not sort of mandated by the school, that doesn't mean it's not. It is recommended, strongly recommended for all 11 and 12-year-olds. Again, you can get it as early as 9. So I think that that's also been some messaging that's a little bit confusing, and it really is strongly recommended. So I would encourage all parents to, as long as you're vaccinating your kids already for flu and everything else, just add one more, and it really could be truly, truly life-saving for your child.
yes.
I agree. Well, thank you, Dr. Price, for joining us today. And we hope we'll be calling you probably for your expertise in another occasion. And thank you for collaborating today with Rochester Healthy Community Partnership.
You're very welcome. Happy to be here. Thanks for having me.
Okay, thank you very much.
All righty. Bye.
Bye-bye, everybody.